I've got a specific task that, as a result of the work that's been done by ORIE in association with WINNN and the government, to make a proposal for a nutrition programme for the future, building on all the expertise and the experience that government and the programmes have done. And this has been this is a programme that's been put forward as a result of a lot of integration and interaction. Obviously, it's just a proposal, but it does build on a lot of things. First thing that was discussed is really, what is the actual aim of the proposal? What are you trying to do? And it was very clear that the 4 aims are preventing of stunting, which fits in with the SDGs, reducing childhood mortality, preventing anemia in women and children, and preventing low birth weight. Those were the 4. These are not, like many nutrition programs, rather vague ideas about improving nutrition. These are very focused, and that was what government and others came up with. A couple of things, I know for this audience this is very much usual language, but it's just to introduce the concept that there are some nutrition-specific interventions and there are some nutrition-sensitive interventions. In other words, ones which may have a specific impact on nutrition, and I come to some of those, and some which actually might not have started off by seeking to improve nutrition, but actually are very clear that they do. And particularly trying to build this programme around the first 1,000 days, a very important concept for improving nutrition. The 4 boxes really just outline where are the targets, where are we seeking to have the greatest impact. And you've got to start somewhere in the first 1,000 days. So we start with school children. We feel that that's actually something that I'm going to explain in the next slide is really quite important. And school-age children, including adolescents, and then you move on to women of reproductive age and pregnancy, neonates, and infants and young children. And having these 4 boxes has the benefit of actually enabling people to focus their thinking when they are developing a plan. Now, I'm going to emphasise that there is, in this plan, a strong evidence-based theory of change. I deliberately even reduced this slide because this is a totally unreadable slide and you're not expected to be. But if you're interested in the evidence-based theory of change for nutrition change, then there are very good articles by The Lancet, there are very good articles by other organisations which are reviewing what are the particular benefits of certain nutrition-specific and nutrition-sensitive interventions. So what, having considered this, having a lot of feedback, a lot of discussion, has been come up by government and the group. First thing is to recognise, as many of you do, that we're not talking about something simple like HIV. We're not talking something simple like malaria. We're talking about a complex programme which has to involve building blocks. And the case of what blocks you actually put into a nutrition programme is obviously something that needs very careful consideration, both in the terms of its cost effectiveness and also its appropriateness, bearing in mind the culture and the socio-economic situation. So make no apology for this is basically a building block approach to what could be part of the next nutrition plan. There are 4 nutrition-specific interventions that are put forward for achieving the 4 goals that were outlined in my previous slide. First is CMAM, second is micronutrients. We can discuss the way those might be improved. Improving IYCF and maternal nutrition, and a very important issue about increased awareness, uptake and provision of antenatal services. And we could probably have put delivery services. One of the data pieces that came out of the ORIE slide is quite shocking, the very high proportion of home deliveries that occur in this community. That's the nutrition-specific interventions. 2 slides on the nutrition-sensitive interventions. And the first is one which comes up time and time again. We discussed this in Abuja, and it's really quite interesting to see commissioners of health who have responsibility for improving nutrition actually quite nervous about tackling this. But we felt that unless this is put down, it's not going to go anywhere. Obviously, there are a whole range of cultural and other factors which determine that. Treatment and prevention of infectious diseases is crucial. We felt that often nutrition programs seem to neglect the fact that children have to be healthy if they're able to benefit from diet. And one of the things that's come out very strongly, not surprisingly perhaps really, has been the need to increase community engagement in nutrition programs. And there's no doubt that there are activities, particularly among women's groups, but they are not sufficiently strong in their engagement with nutrition programs. And then the fourth one is very clear, which was identified by government, improving government capacity and allocation and accountability for resources. So those were the 4 nutrition-sensitive interventions. But then we had another 3. We felt that it's very important when a nutrition program is being designed to identify those in which there is a need for a link with nutrition-sensitive programs. And it was very clear in the discussions between government and the WINNN and ORIE that this is not something that instantly needs to be pulled into a program, but it seemed unwise not to recognise the benefits of working very closely with these programs. There are 3 linked nutrition-sensitive programs. The first is nutrition and health need to be mainstreamed within basic education. Unfortunately, ministers of education don't seem to have very much in their curriculum on health and nutrition. And there are other African countries where this has been incorporated, and it's actually enormous potential for doing this, particularly for boys as much as girls. And we talk about the 3 R's of education: reading, writing, arithmetic, and the 4th R is rearing. How do children get reared? And basically it's a very key life skill for boys and girls to learn. So something working with the Ministry of Education would be really quite crucial, mainstreaming issues much more. Secondly, there is increasing evidence and a lot of interest in the nutritional benefits of WASH programs. I've got some slides which I can bring up. I'm sure that some of you are aware of these. But the fact that there is a lot of interest now in actually achieving effective WASH programs with a particular focus perhaps on specific water, personal hygiene and food hygiene, and it's increasingly being studied about the nutritional benefits of that. So that's something that we really felt very important for future programs. And the third is integrating with social protection. Now, we recognise that there are a whole range of social protection programs going from unconditional to conditional cash transfer, and we've been involved with some of the cash transfer programs elsewhere in Africa, which show variable impact on nutrition. But there are a lot of very important lessons to be learned, and it would seem unwise for a nutrition program not to benefit from some of the nutritional advantages of that. So there were 3 linked programs that should be part of any form of planning. And the final slide really is how to prepare and implement a WINNN Plus. In other words, what is the future appropriate nutrition program for northern Nigeria? 4 steps, nothing particularly rocket science. First is evidence-based theory of change. We've referred to that. Building on positive experiences of nutrition-specific provided by WINNN and the government collaboration. Thirdly, collaboration with government agencies providing nutrition-sensitive interventions. And then being very clear about an operational plan as who's doing what and what are expected out of them for those. And I suppose the 4th would be it's quite important to let a plan run for at least 3 years before adding a new intervention. So I think I've kept within my 10 minutes, and I recognise I've tried to do some extremely complex issues in just a few slides, but it's really to stimulate discussion. So thank you very much.